We shall learn in this presentation the concept and importance of humidification for ensuring better outcome in babies on respiratory support. Nose is a natural humidifier which warms and humidifies air as we breathe in. Nature has created such an infallible system for all of us. However, babies born prematurely are devoid of adequate warming and humidifying mechanism. Above all, babies who are intubated or while on CPAP, administration of cold and dry gases causes injury to the delicate respiratory mucosa. In this talk, we will learn about concepts of humidification, as to what is humidity, how under-humidification affects immature lung, what are the available methods for humidification, what is the importance of heating and humidification, and what are the key practical points of optimal humidification for better clinical care. Immature neonates must breathe to survive, and they must adapt themselves immediately to cold and dry environment. Heating and humidification of gases is essential to prevent inspission of secretions, atelectasis, and thereby reducing ventilator-induced lung injury. It is important to ensure that oxygen is delivered at the nose of preterm, and this oxygen is heated and saturated with water and not cold and dry. What is humidity? Humidity, as we all know, is the amount of water vapor in the gas. It exerts gaseous pressure, which amounts to a partial pressure of water of 47 millimeters when air is fully saturated with water vapor at 37 degrees centigrade of temperature. This corresponds to a water vapor mass of 44 milligrams of water per liter of gas. The partial pressure of water vapor at saturation depends solely on the temperature of the gas. Absolute humidity, it is defined as amount of water vapor in milligrams per liter of gas at a given temperature, and this is expressed as milligram per liter. Relative humidity, this is measure of how much water vapor is present in the gas compared to its full saturation at the same temperature. Hence, this is always expressed as percentage. Let us discuss the importance of humidification. Optimal humidity is a key to good outcome in CPAP. The mucociliary transport system is probably the most sensitive respiratory function to change with lack of humidity. Medical gases, as we know, are often cold and dry. Dry inspired gases, while getting warmed up, takes water from underlying mucosa and results in dehydration of mucus, which slows the transport rate and ciliary beating frequency. Thickened secretions indicates increased need for humidity and heating of gases. Let us understand the concept of heating and humidification. Amount of water vapor a gas can hold depends on the temperature of the gas. Heating of gas increases its capacity to hold water vapor. Cooling of gas decreases its capacity to hold water and thereby loses water as condensate. At 37 degrees centigrade of temperature, a gas can hold 44 milligrams per liter of water vapor, and same gas at 30 degrees centigrade, the amount of water vapor drops to 30 milligrams per liter. Hence, it is essential to remember that if a gas has to be fully saturated with water vapor, it needs to be heated. One experiences this in a rainy monsoon day. While inside the car, which has higher temperature holding more water vapor, the inside glass walls get covered with drops of water which condensates as outside temperature and temperature of the glass is lower. We know as at lower temperature air holds less water, which results in condensates on glass. We need to appreciate the relationship of temperature and water vapor content in the same gas at different temperature. At 37 degrees centigrade, water vapor content is 44 mg per liter, which dramatically falls to 30 mg per liter as the gases cool down to 30 degrees centigrade. Hence, we need to remember that a gas can hold more water vapor only if it is heated. Let us look at the concept of dew point. Dew point is a temperature at which gas is fully saturated with water vapor or has 100% of relative humidity. If a gas cools below dew point, water vapor is lost through condensation. Let us look at temperature of gas which is delivered to the baby. Inspiratory gases should never have temperature more than 37 degrees centigrade as it can cause injury to the respiratory mucosa. Servo-controlled humidifier ensures that temperature is not more than 37 degrees centigrade and the gases are delivered at baby's nose at exact temperature. Always ensure that airway temperature probe is outside the incubator and or radiant warmer. Let us look at physiology of breathing. Upper airways in newborn babies help in warming, humidifying and filtering gases as they pass through the nasal passage. Preterm babies, as we know, have no nasal hair. Mucociliary transport system remains the only barrier against microorganisms. Mucociliary clearance thus is an important pulmonary defense mechanism, and unaltered mucociliary activity is an important parameter for adequate airway humidification. The consequences of insufficient humidifications are well known. There is no doubt that inadequate humidification may lead to progressive airway dysfunction and systemic effects depending on the degree of under-humidification and coolness of the gases, and also the exposure time and the underlying disease. Lung functions may deteriorate. Reduced mucous viscosity may lead to impaired mucociliary transport, secretion accumulation, atelectasis and pulmonary infections. Severe under-humidification finally leads to impaired surfactant activity, decreased functional residual capacity, atelectasis and compromised pulmonary mechanics. Let us look at the effects of pure humidity. Dry or hot gases damage ciliary activity, increase mucous viscidity and may lead to tracheal erosion and necrosis. There is a tendency towards recurrent collapse and consolidation in babies with poor humidification. So, why do we need to humidify gases? Humidification of gases helps in making secretions thin, which can come out very easily. It also prevents mechanical blockage of airways. What is optimal humidification? Optimal humidification is nothing but delivery of gases at core temperature and saturation with water vapor of 44 milligrams per liter at 37 degrees Celsius, and it helps in maintaining intact mucociliary clearance. Optimal humidity helps in maintaining good airway patency, reduces work of breathing and also helps in good gas exchange. It prevents mechanical blockage of airways. What are the various methods of humidification? We know we can humidify gases with heated humidifiers. Also we can use heat and moisture exchangers. And last but not least is aerosolize the gases. So let us look at the concept of humidifiers. Heated humidifiers or active humidification systems operate actively to increase the heat and water vapor content of inspired gases. Inspiratory circuit tubings contain a heated wire which helps in maintaining or slightly increasing the temperature of gases, thereby prevent water rain out before the gas reaches the infant. At a set humidifier temperature of 37 degrees centigrade, the gas absorbs 44 milligrams per liter of water, which corresponds to full saturation or 100% relative humidity. Let us look at heat and moisture exchangers. Heat and moisture exchangers are designed to recover part of heat and moisture content in the expired air. A sponge material of low thermal conductivity inside the clear plastic housing of these devices absorbs heat and condenses water vapor during expiration for subsequent release during inspiration. Some heat and moisture exchangers are coated with bacteriostatic substances and equipped with bacterial or viral filters. However, a dead space and resistance have to be considered while using heat and moisture exchangers in newborns and infant. There is very sparse data and there are problems of clogging and dislodgement. Let us look at aerosol application. Aerosol water particles with sizes between 1 to 10 micron are deposited on the airways by impaction for larger particles or sedimentation for smaller particles. However, this increases water burden on the mucosa. There is always a risk of over-humidification which can increase the resistance, and it sounds impractical. Active humidification. Humidity output depends on gas to water surface area exposure, and it also depends on the temperature of the gases. We know heating increases humidification and cooling results in decrease in the water content of the gases. So let us look at what are the options for humidification. We know we had MR810 humidifiers which were used for respiratory humidification systems which are outdated and still are used for ventilation and oxygen therapy. The newer MR850 respiratory humidifier systems are used for invasive ventilation, oxygen therapy and non-invasive ventilation. Let us see as to what are the problems one can face with humidifiers. If the humidifiers are not set properly, it would result in cooling or hypothermia of gases. However, if the temperature is increased, it can cause hyperthermia and injury to the airways. Sometimes, if the gases are not hydrated, it would result in underhydration, and as a result, it would result in mucus plugging and airway atelectasis. Hypoventilation can also be due to increased dead space. Sometimes there could be thermal injury to the airways due to excess heating, and it can cause injury to the respiratory mucosa. Let us see how we set a humidifier and how we heat the gases. Set the temperature in humidifiers at 37 degrees Celsius and water vapor is added from heated water reservoirs. Inspiratory limb has a heater wire which maintains the temperature during exit through the inspiratory limb. Decrease in humidification would result in condensation of water in the circuit. Insulating unheated segments of inspiratory circuit may reduce this problem. Whenever gases cool down, they lose water which appears as rain out, and this is not good humidification. So let us see how we can humidify gases in a baby on CPAP. Nasal CPAP is widely used for ventilatory support in different respiratory conditions. For most part, humidification occurs in the upper airways. Even with nasal mask or prongs, however, sufficient humidification is necessary to prevent mucosal desiccation and obstruction by dried secretions in the upper airways. In neonatal intensive care unit, airway temperature and humidity are usually set at slightly lower levels for nasal CPAP and non-invasive ventilation as compared to conventional mechanical ventilation. Let us look at the practical aspects of humidification in our day-to-day clinical practice in our NICU. Some dew in the circuit is a tangible sign of adequate relative humidity in the inspired gases. Dry circuit is bad. Whenever we see a dry circuit, it tells us that the gases are dry and there is no humidification occurring in the gas. Always use heated humidification system for optimal heating and humidification of respiratory gases. Some mist in the inspiratory circuit is desirable. Some water in expiratory limb suggests that gases which were inspired were humidified and expired gases lose water on cooling, and this is a sign of optimal humidification. Prefer using the latest humidifier which is available. As of today, MR850 is available in our country. Set the temperature at 37 degree in the chamber and preferably use heated wire circuits. Let us look at some of the danger signs of humidification in our day-to-day clinical practice. Too much water in the inspiratory limb suggests that the gases are cold, and loose water in the inspiratory circuit, which is a bad sign. In this situation, it is desirable to increase the humidifier chamber temperature. Also, use heated wire circuit to prevent heat loss. Portion of the circuit which is not wired may be insulated from the cold environment. Condensate is easily contaminated and may be flushed down the endotracheal tube, which in turn will cause airway obstruction and risk of nosocomial pneumonia, and this in turn will disturb the function of equipment. Gases quickly cool in the portion of tubing which is not covered by heated wire and adapter, and this in turn results in rain out, which in turn will affect the function of ventilator. So how do we clean a humidifier, and is it really necessary? There is increased risk of infection by incorrect use of humidification. Ideally, we should use a disposable humidifier and not reusable one. One can use water bags with continuous filling so that circuit is not opened too frequently, and this in turn will reduce the risk of infection. And thus we learn that heating and humidification are important aspects of respiratory support. Mist in inspiratory limb and some water in expiratory limb suggest optimal humidification. A dry circuit or too much of rain out suggests a major problem. Clean water and disposable humidifiers are key to reduce infection. We are sure if the above concepts are applied judiciously, our babies will have better outcome with early use of CPAP, and complications of inadequate humidification are avoided. Thank you.